This is Dr. Richard Semelka. Today we talk about gadolinium deposition disease, which is a toxicity from gadolinium, which is administered in MRI studies. The appearance of the disease arises anywhere from immediately after the gadolinium injection to within a month of having received the gadolinium agent, and in some individuals it can be even longer than that. But the great majority, I would say perhaps 80% of sufferers, it arises immediately after, during the gadolinium examination, MRI, or within a couple of days. So about 80% of patients, it occurs right away. So it's somewhat obvious if it's symptoms you didn't have before and now suddenly you've got it after getting gadolinium in an MRI study. It is kind of obvious that it's due to the gadolinium agent. So the individuals who are most likely to get it are white women between the ages of 20 to 55 at onset. The next most common group are white men of the same age, but basically anyone can succumb to gadolinium deposition disease. Now, it's a long-lasting condition, and what's critical to note is that the symptoms are new. You haven't had these symptoms before, but if you had a prior MR with gadolinium, of course, you would have had those symptoms, and then getting another gadolinium study, the symptoms generally become worse with each repeat gadolinium examination, and that's why it's so critical to recognize gadolinium deposition disease the first time it occurs in you, or in your patient, or whoever that you're aware of. So it's a devastating disease that can last a long time, a lifetime in fact, and it's critical that you are aware that it exists, and in an upcoming presentation I'll talk about the symptoms. Thank you.